Your eyes and your vision are under attack, damaging blue light from the sun. Your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Microbiome, the only supplement with the exclusive patent on all 3 macular carotenoids and Microbiome technology.
Do your patients know what presbyopia is?
There are people who are afraid of the press.
Have you talked to your patients about multifocal contact lenses?
I've heard the bifocal, but not multifocal.
Exactly, not multifocal.
Do you need help with your multifocal strategy? Learn more at the conclusion of this episode. With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MySight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you. Jeff, why is detoxification, in your opinion, not part of or a big part of Western medicine?
Well, I think that from what I've heard from a number of conventional Western doctors is that we don't need to detox because our bodies naturally do all the work for us. So they say we have a natural detoxification system, our kidneys, our livers, our skin, and everything that's coming into our body is just naturally leaving. Now, that's great in theory, but in reality, with the number of just the toxic exposure that we're faced with in the 21st century, our bodies just genuinely cannot keep up with the level of toxins. And that's where we need additional detox support so we can prevent that accumulation of these toxic elements over time, which lead to a number of issues.
And you talk to doctors all the time, and doctors that are not familiar with detoxification. When I was a kid, we called it excretion. When I went to junior high school and high school, now we call it detoxification. Why do you think, though, what do they tell you why they have left this out of their practice?
Well, generally, there's just, they're limited to what they've learned in medical school. So they've got the standard of care, what they're trained to do, that they can't really go outside of without getting in trouble. And that's what I think just this current teaching is still, that the body detoxes on its own. And then they do teach about there are occasions where chelation can be used. So synthetic chelators like an EDTA or something can be used for an acute lead poisoning or some sort of issue where you were just recently exposed. But they're really more focused on those short-term emergency situations opposed to the long-term chronic situations that occur from just a slow buildup of toxins that we're exposed to basically on a daily basis.
When I look at the components of health, sometimes it could be broken down very simply into 3 components: genetics or epigenetics. Genetics really counts for only, now we know, 10 to 20% of disease, nutrition deficiency, nutrition excess, and then, of course, there's environmental toxins. And our bodies are enzyme machines. And as our nutrition gets bad and we're exposed to poisons, those enzymes aren't working very properly. So if you could talk to us about why it's important to detoxify.
Absolutely. And those just toxicities and deficiencies, super simple, right? The challenge is a lot of people are doing everything right. They're doing the best they can. They're getting the proper nutrients. They're taking great supplements. They're getting nutrients from whole foods. But if they've got underlying toxicities, those toxicities in themselves could be resulting in the deficiencies. So I think you have to have a 2-step approach: out with the bad and in with the good. So even if we're putting in all this great stuff from our bodies, if we don't remove the toxic elements, our efforts might be limited. And I say, living in the 21st century, we all have to be doing some sort of detox, right? We're not going to stay healthy by accident anymore. We have to take control of our health just to keep up with the stressors of 21st century living.
And we're going to go through what it takes to detox. And I feel it's very, very important. When you look at some of the studies, there was a study out of Columbia Presbyterian, and they looked at cancer, and they over 95%, I think it is, or 99% of cancers are from environmental toxins and poor diet. So when we look at the environment, what are some of the things that are causing us to be toxic?
Well, if you want, just the simple breakdown is food, water, and air. So, right, lots of things. I mean, just from the water, you can go to the Environmental Working Group website and just type in your zip code and see a lot of the contaminants that are in your water supply, the tap water. Just think, even if it tastes good and you think you're drinking clean water, and we certainly have cleaner water than a lot of countries, but even that is loaded with a number of toxic elements, medication byproducts, metals, plastics, various things. Then you've got just pollutants in the air, and air quality is going to be different based on where you're living. Just the food in general, the food has changed so much over the years, from natural to more unnatural. Even the natural foods today, a lot of times, are just really not natural anymore. We've got genetic modification, we've got these herbicides, pesticides, all these things added to the foods, and now we're being bombarded with chemicals even from eating whole foods. And even when we're eating organic, which is, I think, ideal, a lot of times there's some cross-contamination where some the glyphosate and some of these environmental toxins might go onto the organic fields, and you're even getting some chemicals that way. So it's just very difficult to completely, if I don't think it's possible at all, to completely avoid toxicity. So that's why I think having an active detox protocol is a great strategy.
Yeah, and I want to go through some of the things that are in the food and in the water and in the air. And as we go through the discussion, we're going to do that. But I just want to give like a background a little bit. When it comes to toxins, there's persistent and non-persistent toxins. So the persistent toxins are the ones that are really hard to get rid of. They tend to be man-made, PCBs. And if you could talk about that, salmon, farmed salmon probably has the most PCBs than any other type of food that we eat. So we think that we're eating salmon, but we're eating healthy, but we're eating farm salmon and it's full of PCBs. If you could talk a little bit about that.
Yeah. So, and it's just tricky because we're always trying to get the best food, right? It's just, what is the best? Okay. So we have all these thoughts, but we're usually missing something. So we say, let's go with the farm raised salmon because maybe it doesn't have the mercury accumulation because it wasn't in the ocean, but then we have the PCB issue. So there's always it's hard to know exactly what the best option is. Generally, I say just go with as natural as you can. Salmon naturally are in the ocean. That's probably the best place to get them. You still have to be careful because, yes, they're probably going to have some level of mercury. Once again, that's where the detox comes in handy. So if you are going to enjoy some salmon every once in a while, it's probably going to be a good idea to take some sort of detox agent alongside it to help grab some of that mercury in the fish before it can accumulate in your body.
And if it says Atlantic salmon, to me, Atlantic's a code word for being farmed. And, you get wild salmon, Alaskan wild salmon, or wild salmon in general. Can you talk a little bit about the difference between farm salmon and wild salmon?
So the natural is really going to be, ideally, someone has a boat in Alaska and they're out there on the boat and they're fishing for the salmon and they hook you up with some of it, right? They give you some. That's what I would consider natural salmon. Then you have these larger operations, which some of them are still going to be okay. They're going to be just grabbing large amounts of salmon from the natural ocean as possible. Then you've got the farm operations where you're just jamming a ton of salmon into a smaller area. They're farming them for mass consumption, and that's where some of the issues can come in.
We were talking about persistent toxins, and we'll talk about non-persistent toxins, but persistent toxins are sometimes called forever toxins. We talked a little bit about PCBs, dioxins, but also the heavy metals are persistent. Can you talk about the heavy metals and which ones are persistent, and why is it a problem if it is persistent versus on a toxin that is non-persistent?
Sure. So, persistent, it's going to persist in the body, right? It's going to be a lot harder to get rid of. A lot of times these things are passed down from mother to child. So children can actually be born with a lot of these toxins just passed through the umbilical cord. So that's an issue. And that's one reason it's very important for parents to go on a detox regimen before trying to get pregnant. Now, mercury is definitely one of the more toxic elements that can accumulate in tissue and also be passed on. There's a number of sources of that, but that one seems to be pretty toxic. I believe once you accumulate a certain amount of one of these metals like mercury, then you start accumulating the other metals more quickly as well, because your body's natural detox processes start slowing down.
And, we were talking a little bit about the PCBs before, and, they have been linked to rheumatoid arthritis, especially in females. There's been some studies in it, but it's been outlawed in 1976. Why are we still getting it in our food supply? Do you have an idea for that?
Well, I'd say a lot of things are outlawed, but there's sometimes with the laws, there's still trace amounts of these things that are allowed to be put in manufacturing, even if they're there's a safe or a legal limit. That might be the law change. I'm not completely sure on this one, but then with the persistent things, a lot of times they're passed on, or they're just persisting in the environment because they're so hard to get rid of that it's not like they're just all destroyed. They're just kind of, whatever was produced is still going to be around because they're persisting, or might still be exposed to some of those things.
Dr. Johnson, we're so happy you're one of the world experts on carotenoids, and most of the public doesn't even know what a carotenoid is. So tell us, what are carotenoids?
Well, this is a perfect part of the year to talk about carotenoids. If you live in New England like I do, and all the leaves are turning from green to red and orange and yellow, that red and orange and yellow, those are carotenoids. And carotenoids are plant pigments. So think of your tomatoes, think of your pumpkin pie, which we'll be thinking about next week, and think about your corn and your spinach. And now spinach isn't red, yellow, or orange, but if you leave it out in the sun and it starts to, deteriorate, what's happening there is the chlorophyll. Chlorophyll is green and it's breaking down to reveal those carotenoids. One of which is lutein, and that's the one that you'll find in spinach.
So lutein, what foods have the most lutein in it, would you say?
Well, if you look at your dark green leafy vegetables, like your spinach, like your kale, like your collard greens, those are all going to be very rich sources of lutein.
And if you cook these vegetables, do you lose the carotenoids? Do you increase it, or does it make no difference?
Well, actually, cooking's a really good thing to do. So when you think about the plant cell, it's different than the cells I have in my body because they have a cell wall. So when you cook it, you chop it, you juice it, you break that wall to allow those carotenoids to be released and better absorbed from your gut into your body. So actually, that's probably a good idea. Although I would never discourage someone from eating a spinach salad, because you're still going to get your lutein. You just might get a little bit more if you are going to cook that spinach.
And you brought up juicing. Is there a difference between juicing and blending? Do we even know?
I don't know, but I would think no, that with the really objective being to break down those plant cell walls. So if you're doing that, you're doing good.
And how many carotenoids are there in nature? How many are in our diet? How many get into our blood? And how many get into our eye?
Well, this is what I find totally amazing about lutein is when we look at nature, in nature, in any plant that's got these bright colors that are red and orange and yellow, there are about 700 in nature. And in our diet, we might be eating maybe 50, and about 20 get into our bloodstream, our circulation, and other tissues. But from that 700 down to the 50, down to the 20, down to the 2 that get into your eye, into the a part of your eye called the macula. And what the macula is, it's part of the retina. The retina is in the back of your eyeball. So when the sun comes in straight directly into your retina, dead center. That's where your macula is, and that's where your lutein is. And the amount of lutein that's in the macula is about 500 to 1,000-fold more concentrated than anywhere else in the body. So to me, that gives some biological plausibility for it being important, not only because there's so much there in the macula, but it's where you want it to be. Because if you remember, I said the macula's dead center in the retina. Dead center in the retina means it's going to get a direct hit from sunlight. And think about that spinach salad in the sun turning, colors because it's getting destroyed. Same thing can happen in your retina with decades of light exposure. So to have something like lutein there in high concentrations is a good thing. Lutein's yellow, and the visible light that reaches your retina is blue light. Blue light is visible light. And because of those colors, the yellow and the blue, that blue light gets absorbed by the yellow light, so it can't go on further in the retina to those photoreceptors to cause damage, light damage. So that's one property of lutein. It absorbs the blue light, so it can't do damage. And it's also an antioxidant. So think of oxidation, that's usually not a good thing. Think of a rusty nail, that's oxidation. So antioxidant helps prevent that oxidation. And lutein does that. And the eye is very metabolically active, so it can produce some oxidation. So to have an antioxidant there is a good thing. And the epidemiology, that is when you look at large populations and what people are eating and what health outcomes they have or don't have, you find that the epidemiology really supports the idea of eating more lutein from your green leafy vegetables is associated with a decreased risk of age-related macular degeneration. So remember that word, macula, age-related macular degeneration, a major cause of visual impairment among the elderly. Because think about it, it's been decades of light exposure to that eye that with age, that's going to be a risk factor to something called age-related macular degeneration.
So the macula is about 5 millimeters of the eye in the central part of the eye. Now, you mentioned that the blue light is the only light that hits the back of the eye. People thought that UV light at one time would reach the macula. Does any UV light actually reach the macula?
That really, the lens takes care of that. I think that's where most of that happens. So that just like with macular degeneration, there is some epidemiology to support high intakes of lutein to decrease the risk of cataract, so lens cataract. And when you look at the carotenoids that are in the lens, lutein is the dominant one. So it's there too. So it's probably having a role there as well.
So there's been some studies that show that lutein, zeaxanthin decrease cataracts. And some of the research on that, what's your feeling on that?
Well, just like with the retina, being vulnerable to oxidative damage, the cataracts are too. And so again, cataract you think of as an age-related eye disease, right? Because it's decades of exposure to light, and you have these antioxidants in the lens that can help prevent that. And again, the epidemiology supports that.
And you talked about blue light before and if there's enough pigment in the back of the eye, it'll absorb the blue light. How about if there's not enough? Are we going to get a lot of glare and scatter from the blue light? And will people have trouble with glare or sensitivity to the sun if they don't have enough of the pigment that the lutein makes to protect the macula in the back of the eye?
Yes, lutein does help with the glare, and those studies have been done and very well. I haven't done those studies, but my colleagues have, and they're well-designed studies. And a well-designed study is something where you have a placebo, so they're not getting this active ingredient, in this case lutein, and you have subjects that are getting lutein, and no, it's double blinded, meaning that the subjects don't know whether they're getting the placebo or lutein, and the investigator doesn't know who's getting what, or the people doing the test. So that's the gold standard of clinical trials. And in those studies, they find that supplementation with lutein actually decreases glare. So it's really an important thing. And as I get older, I'm noticing when I drive at night that I can tell that I have issues I didn't have when I'm younger. And I'm just a strong supporter of eating those green leafy vegetables to make sure that things don't get worse.
And before you mention the back of the eye, the macula, there's two carotenoids. But how do you add in mesozeaxanthin to make it three, the lutein zeaxanthin and mesozeaxanthin, or is mesozeaxanthin just really part of lutein?
Yeah, we did that study because there was question, where does this mesozeaxanthin come from? Because if you look at what we're eating, there's not a lot of foods that contain mesozeaxanthin. It's mostly zeaxanthin and lutein, zeaxanthin, mesozeaxanthin. They're all isomers, which means they all have the same components in their structure, but they're just bent a little or twisted a little bit differently. So they are different. And when you look in the macula, you find that the composition of that, what we're going to call macular pigment, so lutein, zeaxanthin, and mesozeaxanthin, the composition in the macula can change depending on where you look in the macula. So the studies that we did looking at, where is this mesozeaxanthin coming from in the retina, since you don't really see it in foods so much? So we did that study where we fed monkeys pure lutein and pure zeaxanthin. And the reason we use monkeys because unlike your usual laboratory animal, the rat, the gerbil, or the mouse, monkeys have a macula. These other more traditional laboratory animals don't have a macula. So that was a good model for us to look at what happens when you eat just pure lutein or just pure zeaxanthin in these monkeys that had never eaten a carotenoid in their life because of the design of the studies that they were in. And when we did that and then looked at what was in their macula, we found that those monkeys fed pure lutein converted that lutein into mesozeaxanthin. Whereas those monkeys fed pure zeaxanthin, there was not any conversion. So yeah, that's where it's coming from. And when you look at the composition of zeaxanthin in the retina, about half of it is mesozeaxanthin, about half of it is zeaxanthin. So the retina seems to want mesozeaxanthin there as well as these other two macular carotenoids.
So the mesozeaxanthin is dead center in the macula of the eye, the center of the eye, the center 5 millimeters, the part that allows us to see. Around it is the zeaxanthin, and around it is the lutein. Is that how it works?
I didn't go that fine to really tease out, but you'll find the zeaxanthin in the center, very center, because we did punches, and so the distribution of meso versus the zea, I think, is about the same. But what the point being is that zeaxanthin, most of what's in the center is zeaxanthin and mesozeaxanthin, and as you go out, more of it becomes lutein.
MacuHealth, your science-born and tested solutions for visual performance, macular degeneration, and dry eye syndrome. New products coming soon. Embrace the science.
The public doesn't realize, is there really a connection between health and these little organisms that live inside us?
You know, there absolutely is. In fact, we cannot function as a human without our microbiome. So if you think about our microbiome as being this massive collection of organisms that exist all over the human body, every part inside us, all everywhere around us and outside us. And in fact, they control the vast majority of biochemical functions that happen in the body. Just to put it in perspective for people, we have about 1.5 times more microbial cells in our system than we have human cells. And even more surprising, we actually have about 250 times more microbial DNA in our body than human DNA. So we have far more microbial genetics than human genetics, which means that the vast majority of biochemical functions that occur in our body, just being humans every single day, doing the things we do, the vast majority of those are coded for by the microbes in our system.
You know, it's amazing. If you could talk about where 70% or maybe more, maybe 80% of the immune system is located.
Yeah, so the immune system is primarily located in the GI tract, so your gastrointestinal tract. You've got this massive surface area of digestive system in your GI tract, right? If you unfolded all your intestines and your digestive tract, it works out to about the size of a professional tennis court. So it's a huge surface area. And about 60, 70% or more of that surface area has immune tissue on it that's sampling the world around you and trying to make decisions as to what to attack and what not to attack. And all the while, every square inch of that surface area is also covered with microbes. And all of those microbes communicate with your immune system to try to aid and guide your immune system in conducting the most proper immune function in the body.
You know, they've done studies on hunter-gatherers and people that have the Western diet. What's the difference in the bacteria that lives in us compared to the hunter-gatherers?
The biggest difference is really the diversity of microbes. You know, our ancestors who were hunter-gatherers, foragers, they had a really vast, diverse microbiome in their system, which of course, as we talked about earlier, because the microbiome provides us functionality and genetics, it means that they had even more capability and even more functionality in their system, which allows them to adapt to more things, to deal with more stresses, to deal with more negative stimuli in their day-to-day lives. Now, today in the modern day, because we have so many things that kill microbes in our system, right? Everything from antibiotic use to the chlorine and fluoride in our drinking water, the pesticides all over our food systems, all the personal care products with antimicrobials in it and antibacterials and all that in our system, all of those kill our ecosystem. So the modern human, the Western human that's walking around the streets has a small fraction of the original microbes that humans started off with.
You know, COVID has made this a lot worse, but moms are running around after kids, you know, spraying their hands with disinfectants, not letting them play in the dirt. Can you talk about the hygiene hypothesis and why eating dirt or being, there was I think the movie called Eat Dirt or something like that. Mm-hmm. Why maybe we're being too clean?
We absolutely are. I mean, there's a whole amazing tsunami of evidence that has been generated, and as more is coming out, that shows that we are overtly hygiene, right? We're trying to sterilize our homes, we sterilize our cars, we sterilize our bodies all the time. When you look at it in the microbial world, 99.99% of microbes are either beneficial or benign. It's a very small percentage that's actually harmful or pathogenic. And the thing is, most of the time, the harmful or pathogenic organisms are allowed to take hold because the other 99.9% aren't flourishing. Those microbes do a better job of controlling the problematic microbes than we ever could. Just to give people two examples, in Finland, they did a long-term study to understand why allergies and asthma were getting so bad in their children. They discovered it's because they were over-sterile. And so what they did is they took a number of daycare centers and they implemented dirt piles in these daycare centers, and they started having half the kids that go to daycare play in the dirt piles 2 or 3 times a week, and half the kids not play in the dirt piles, obviously. And then they followed them for a few years, and they found that the kids that played in the dirt piles actually had a lower incidence rates of allergies and asthma. There was another great study on moms and babies where they followed two groups of moms. Moms who, when the baby dropped their pacifier, the mom would pick it up and sterilize it and clean it with a wipe and give it back to the baby. The other set of moms were ones that would pick it up, put it in their own mouth and clean it, and then give it to the baby. The moms that did the practice of putting it in their own mouth and cleaning it had babies with lower incidence rate of immune issues, viral infections, allergies, asthma, and all that. So we know it's very clear that we have to have a relationship with microbes. We have to have microbes around us. And if we diminish that by sterilizing things, it harms us at the end of the day.
You know, I'm so happy to have you. Reading your book, your personality comes out, your positive personality comes out in the book, and your love for helping people. And you really want to help people. And I could see from past interviews I've watched and listened to and reading the book. And but I have to ask you, do people really breathe incorrectly?
Not all. You know, it depends on the person. It's like everything else. There's a genetic predisposition, but there's also an environmental influence. But I think the major pressure that will influence breathing is stress, chronic stress. So it depends on the person.
Yeah, and you know, when we're born, we don't breathe. We don't breathe through our mouth when we're born. We breathe through our nose. Is that correct?
Yeah, correct. Anatomically, it's very difficult for us to breathe through our mouths when we're born. And it's only maybe after a number of months that there's space that anatomically we can actually breathe through the mouth. And that's why it can be problematic for very young infants, because if they have a stuffy nose, they find it difficult to revert to mouth breathing because they're so reliant on nasal breathing. But children can be born with a compromised airway anatomically, and unfortunately, if the child is unable to breathe through the nose and can't switch to mouth breathing, it can suffer from lack of oxygen.
So let's get into it early. What is the proper way to breathe?
Well, first of all, it's in and out through the nose. That's the foundation. The mouth does absolutely zero for breathing. And breathing should be light, it should be slow, it should be driven by the diaphragm. Breathing should be effortless. And I think a lot of people who are listening that may have problematic breathing, they often feel that they can't take a satisfying breath. They feel that their breathing is an effort. Or they might notice their breathing is a little bit faster in upper chest. And if they're mouth breathing and they're waking up with a dry mouth in the morning, you know, so those are the typical traits that we would distinguish between a good breather and somebody with suboptimal breathing. But the easiest way to think of poor breathing patterns is ask yourself, how would one breathe when you get into a difficult situation? So when we get stressed as human beings, our breathing speeds up. So we're breathing more breaths per minute. We breathe harder, so we can take increased volume of air with each breath. We have irregular breathing patterns. We may stop breathing, or we may be sighing frequently. We're breathing up our chest. There's no natural pause between breaths, and we feel air hunger. And it's the same traits of how we breathe when we are feeling highly stressed as found in dysfunctional breathing. And there's an interesting cyclical loop there, because of course it's not just going to be a stressful situation that changes your breathing patterns, but it's your underlying breathing pattern is going to influence your reaction to that stressful situation.
You know, I have a cousin who is a speech and language teacher. And when I started doing podcasts, he spent time with me breathing properly to speak. And it's almost the same way. And it took me a while to learn how to breathe through my nose and make my diaphragm expand when I'm speaking, rather than doing mouth breathing and breathing where my diaphragm would go in and then my abdomen would go in. And it's something you could train, and I've gotten a lot better at it. But sometimes when I don't think about it, then I'll say, well, maybe I am mouth breathing and I have to go back to proper breathing. And when you're breathing properly, I do find that you actually can relax better and you actually sleep better when you're breathing properly. And if you could talk about some of the benefits of nasal breathing, and especially, you know, being a physician, an eye doctor, I'm very interested in how proper breathing, nasal breathing increases nitric oxide. And if you could talk about that and the benefits of nitric oxide to the body.
Yeah, the human nose performs a number of functions that the mouth simply doesn't do. You know, if you were to look into your mouth and ask, what is in your mouth? Okay, we have the teeth, we have the hard palate, soft palate, we have the throat, we have the tongue. None of those items do anything in terms of breathing. So the mouth has zero role to play other than to allow air straight down your throat into the lungs. And the nose does everything when it comes to the breath. I have a list of at least 30 functions of what the nose does. And one of those functions is, of course, harnessing the gas nitric oxide. So this gas nitric oxide was first discovered on the exhale breath of the human being only in 1991. So it's a relatively recent discovery, but it does a lot of work in terms of bronchodilation, redistribution of the blood throughout the lung, sterilizing of the incoming air, dilating the blood vessels in the lungs. And it was discovered in 1988 that when individuals were continuously nasal breathing, the partial pressure of oxygen in the blood increased by nearly 10%. You also alluded to a few things. If you breathe through your mouth during sleep, and this is really what got me into, there were two things that got me into breathing. One was improving my breathing patterns made a tremendous difference to my airways, my asthma. And the second was people with asthma don't just have asthma. They very often have a stuffy nose and they're very often tired. Breathing through my nose significantly improved my sleep quality. So, you know, even for somebody to say, well, like we're not looking for nasal breathing 100% of the time. I know that when I'm talking here, in order to have a flow of sentence, there are times that I will take a light breath in through my mouth. That's normal. So, but we do want the mouth closed as much as we can bring it into our life, but we have to be realistic about it. Like, you know, the thing about mouth breathing is that there's no real definition of what constitutes a mouth breather. How long during the day or how much time during the day or during sleep do you have to have your mouth open before you become a mouth breather? Nobody really knows. So we have to use common sense. Breathing through the nose during sleep, you spend more time in deep sleep and less time in light sleep. It reduces the risk of snoring by 47% in a recent paper. Mild to moderate sleep apnea by 47%. So there are benefits in sleep, but also in states of mind with nose breathing. And the other thing I'll say, Dr. Gelb, is when you breathe through your mouth, it typically activates the upper chest. And any of your listeners can think of that because if they look down at their chest and if they take a breath through the mouth, they'll typically see that they are breathing higher. And that's not ideal because the diaphragm is not just for respiration, but it provides stabilization for the spine. 50% of people with lower back pain have dysfunctional breathing. Up to 75% of people with anxiety and panic disorder have dysfunctional breathing. At least 30% of people with sleep apnea have dysfunctional breathing. The same figure for asthma, but unfortunately breathing is quite understudied, so we don't always have specific numbers.
Dr. Zucker is a well-known speaker, educator, and researcher in the field of liver disease. Dr. Zucker, thank you for joining me today.
My pleasure. Thank you for inviting me.
You know, Dr. Zucker, my goal is to shed light on liver disease and what we could do to prevent, treat, and at least slow the progression of this serious but seemingly unappreciated disease, not only by the public, but even by physicians. Why do you think that may be?
People who have liver disease tend to get stigmatized. There's an assumption if you hear that someone has a liver problem that they either drink too much alcohol or they use drugs. And so once you stereotype the disease, it becomes very hard to look past that.
Interesting. Now, people don't realize, but from last I saw, liver disease is now the 7th leading cause of death in the United States, and it's increasing every year. Can you go over some of the epidemiology of how many people have liver disease and if those statistics that I mentioned are correct?
That is largely correct. There are estimated to be about 4.5 million individuals in the United States who suffer from some form of liver disease. and a proportion of them will go on to develop cirrhosis of the liver, estimated about 600,000 in the United States. The reason that liver disease tends to be increasing, or the trend has been increasing, is because there's certain disorders that are increasing in frequency. The main one being what we call metabolic fatty liver disease. It's estimated that as many as 30% of the US population has metabolic fatty liver, and that has been increasing with the obesity epidemic. So that's one of the main reasons. The other is that alcohol use has been increasing in the United States, and alcohol-related liver disease has been increasing as well.
Of the people who get fatty liver disease, which you said is about 30% of the US population, why are they getting fatty liver disease?
Well, there's a number of risk factors for fatty liver, one of the main ones being obesity. And in general, in the United States, there's a trend towards increasing weight. But also other risk factors include diabetes, high blood pressure, high lipid levels like cholesterol, triglycerides. All of those are commonly associated with fatty liver.
So fatty liver is also called MASH, is that correct?
Correct. So there's been a change in terminology. It used to be called non-alcoholic fatty liver, but that terminology, the sort of a negative terminology, was thought not to be as descriptive. So now it's called metabolic dysfunction associated liver disease, or MASH is a short abbreviation.
Now that we have 30% because of, our diet, I would assume that the American diet is so poor. Of those 30%, what percent could go on to get cirrhosis, very severe liver disease?
It's estimated that 5 to 10% of patients who have metabolic fatty liver will go on to develop cirrhosis. So it's a sizable number of individuals. And the scary part about it is that it frequently is asymptomatic. So I will see individuals who present when they have a complication of their liver disease. And when I go back and look at their records, it was clear that they had this ongoing for decades.
Now, there are some doctors that when you come into their office, they'll do some type of scan to see if you have fatty liver. What's the name of that scan and how useful is that?
I believe you're referring to something called a fibroscan. And what it is, it's a technique called elastography. And it's exactly like it sounds. It measures how elastic the liver is. There are several ways to do that, but the one that we use, the FibroScan, is very convenient because it's office-based. It takes 5 minutes to do it. It doesn't hurt. It's very simple. And so we can have people walk into the office and within 5 minutes can give them feedback on how fatty the liver is and how stiff the liver is, which roughly correlates to scarring or damage within the liver.
So fatty liver is part of metabolic disease, the American diet. Can we reverse fatty liver without drugs through natural ways?
Yes, for sure. So it's been clearly shown the most effective treatment for metabolic fatty liver is weight loss. And in the rule of thumb is loss of 10% of your body weight from the time of diagnosis will not only prevent disease progression, but will actually result in regression of the fatty liver. It even can result in regression of any scarring that's in the liver. So you can see substantial improvement.
So when we have a metabolic syndrome, we have the big belly, we have elevated triglycerides, low HDL, high LDL, the blood pressure is starting to creep up a little bit. The blood sugar is starting to creep up. So will people get fatty liver before they become insulin resistant or diabetic, or even become diabetic, or do they typically get it after, or everybody's different?
Well, there's a little bit of variability in that, but I will say that many patients will have some degree of insulin resistance or what we call pre-diabetes. So you don't necessarily need to be overtly diabetic, but if you have pre-diabetes, that is a predisposing factor to developing fatty liver.
And what do you think are the worst foods to cause fatty liver?
Well, what we tell patients, so the real bad guys are the refined or processed carbohydrates. So foods with high fructose corn syrup in them, all the yummy stuff, the sweets are really the bad guys. But other things that people don't necessarily think about are white bread, white rice, pasta, sugary drinks like sodas. Those are they contribute substantially to the development of fatty liver.
So when we put somebody on a diet for fatty liver, obviously we're going to eliminate those. Is there any specific foods that you want people to eat?
Well, you can eat most foods. In fact, the diet that's been studied the most in fatty liver and is recommended by many of the major societies is the Mediterranean diet. I like that diet, and I do recommend it to my patients because it's not very restrictive. It is enriched in fruits and vegetables and de-enriched in those processed carbohydrates, but it's something that is not terribly difficult to follow. And for that reason, I think it's an effective diet. Other diets work, so you can use almost any of the diets, the paleo diet, the Atkins diet. Those are effective, but they're just much harder to maintain. And it really is a lifestyle modification. You need to do this long term in order to have benefit.
And how about becoming a vegan?
Absolutely. So a vegetarian or vegan diet can work very well for fatty liver. Many of my patients, they'll wince if I bring that up, but it is an effective way to lose weight.
I want to talk about high fructose corn syrup for a minute. I have a patient who comes in with a big bottle of soda every time he comes in, and he's drinking like a pint of soda every day. And I've had other patients that drink soda 3, 4, 5 times a day with all that high fructose corn syrup. Tell me about that.
Well, that's been clearly shown to trigger fat accumulation in the liver. And those are things definitely to avoid if you want to have a healthy liver. But they also contribute to weight gain and diabetes. So it's not just purely the liver that becomes problematic for people who drink a lot or take in a lot of that high fructose corn syrup.
Your eyes and your vision are under attack. Damaging blue light from the sun, your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Microbiome, the only supplement with the exclusive patent on all 3 macular carotenoids and Microbiome technology.
Fitting multifocal contact lenses presents a big opportunity to meet patient needs while growing your practice. Alcon is your partner not only with our innovative portfolio, but through e-learning. Learn to enhance your multifocal strategy today with the Alcon Experience Academy.
OIE Broadcasting is the emerging leader in social media. We use scientific entertainment to drive more patients into your office. Visit oybroadcasting.com and sign up today.